First of all, the decision to move back to Nigeria was my parents. I was a minor at the time. They wanted their children to be brought up in Nigeria, and this is one of the reasons why they moved us back. We have a lot of smart people who are leaving Nigeria or intending to leave Nigeria at incredibly young ages. I mean, when I was a student, someone did nursing because they admired Florence Nightingale. But now you dig deeper and they're doing nursing because nursing is really the easiest way to leave Nigeria.
Curated Conversations is our monthly series by Nigeria Health Watch, where we sit down with experts, policymakers, and thought leaders focused on conversations and issues shaping health systems today. The aim is very simple, for us to discuss and explore what's happening, what's not working, and what really needs to change. In today's conversation, we are with Professor Iruka Okeke, a leading bacterial geneticist whose work spans antimicrobial resistance, laboratory science, health system strengthening. She's a fellow of the Nigerian Academy of Science, the African Academy of Science, and the American Academy of Microbiology, just to name a few. Her career reflects a very powerful example of brain gain, combining global scientific training with a long-standing commitment to building scientific capacity in Nigeria. Professor Iruka Okeke, I'll call you Iruka if you don't mind.
That's fine.
It's a real pleasure to have you with us today in Abuja. We're really keen to really talk to you about your work and your experience, and really looking at how, we're exploring grounded science and how it can help shape Nigeria's health system for today and also for the future. You have a very long history and are a very respected scientist in this field in Nigeria. And looking back at your background, you were born in the UK, but you moved to Nigeria in your teens, where you carried out your secondary and tertiary education. So looking back, what really inspired your interest and love for science and your love for scientific research?
Well, thanks for having me, Vivianne. It's a pleasure to be here. First of all, the decision to move back to Nigeria was my parents. I was a minor at the time. They were Nigerians, met and married while they were students in the UK, and they wanted their children to be brought up in Nigeria, and this is one of the reasons why they moved us back. So, I mean, right from high school, I loved science. My best subject was biology. And so it was natural that I would drift towards the sciences. I remember when I was filling the JAM form in the JAM booklet, I saw all these courses like biochemistry, microbiology, and I looked them up in the library, and they sounded really interesting to me. Those were the things I wanted to do. But I was told at the time that I should do a professional course. So I did pharmacy. Although most of what I do now, I do teach in a pharmacy school, most of what I do now is microbiology and biochemistry. So I was really just following my interests. It so happens that my interests are very relevant to some of the health issues that we have in Nigeria today. But I was driven first by my interest and my passion for science.
I think it was really great to hear how before previously you mentioned that you were told to choose a profession, I think, as parents. I think that's changing now. Students have a wide field of courses and professions to carry out. But at that time, microbiology was probably not thought of a career per se. But it clearly showed your determination, really, and your love for science. And you mentioned that your parents moved you back here to enable you to basically understand Nigeria a lot better. So you represent, in a way, that counter narrative. In the health profession, there's a lot of discussions around the brain drain with our health workers leaving the country. But for you, it's the reverse, the brain gain. So you trained as a scientist in Nigeria, really showing that the expertise is here. But having said that, what do you think needs to change in our science infrastructure and how we value STEM as the foundation to enable talent not only to emerge, but as you came back, for that talent to actually stay in Nigeria?
Yeah, I think one of the things I know, which many young people may not know, is that the discovery potential is huge here. We have large biodiversity. A lot of it has not been catalogued. So if you're doing science here, your chance of finding new things is very, very high. People who do science abroad know this. Many of them want to come and do science in Africa. So the discovery potential is huge. The human potential is also huge. You have a lot of young people, some of them very, very good in the sciences. And, I'd like to disagree with you on the point that people are now given freedom to explore their passions. Many of my students are still being given the same advice I was given. Go to medical school, go and do engineering, go and do law. Not that those are bad career paths, but if you said you wanted to do mathematics or microbiology or botany, it's always thought of, well, those should be your second choices. And I think it's really important for us in this country to let people do what they do well. And then when you do what you do well, you can become a leader in whatever it is. Our best microbiologists should not be people who didn't get the score for nursing or medicine. Now, in terms of the, migrating to Nigeria as opposed to migrating out of Nigeria, I should say that when I got my degree, first as a grad student and then later on, I did do several years of work, of research outside of Nigeria. I did a year of my PhD outside Nigeria. I did a postdoc. I had faculty positions outside Nigeria. And this gave me the opportunity to compare what it would be like to do science somewhere else and do it here, and to see that the discovery potential was huge. Now, I mean, there's some things that we don't have. Our infrastructure is not as good. The resources available are not as many. But that still doesn't mean that you can't do good science. It means that you then have to think very carefully about how you're going to deal with those things. The same way we all do in Nigeria. We think about, if you want to watch a movie, you think about, well, what will happen if the power goes out during the movie? And then you make arrangements to either pause the movie or have some power backup. So the same applies to science. And it can be a bit of work to do that, I have to admit. It is sometimes easier to take the easy path and go and watch your movie in a country where the power doesn't go out. But you can see a lot more here, and that was one of the things that essentially called me back. The second thing that called me back is the amazing amount of talent. We have such bright young scientists in Nigeria. It's been a real pleasure and a privilege to work with them. And that is one of the things that makes me smile every day.
That's really great to hear, because what you're saying actually sounds very encouraging for potential future scientists. So what you're actually saying is there is an opportunity that scientists can take advantage of, because there's so much to discover in Nigeria in the field of discovery, in the discovery of science. But you did mention that before you came back, or before you kind of moved back fully, you had worked in other institutions where, no doubt, things like the funding that was required for the research was already there. In Nigeria, we often are quite reliant on external funded resources for research, as we are in the health sector. So from your perspective, given the fact that we do not have that focused funding as much as other countries, what are the potential risks in terms of looking at our dependence, and how do we build domestic investment for science research, and why really does that matter if we are to be, beyond just being recipients of scientific knowledge, but actual participants in actually building and creating that knowledge?
Yeah, first of all, I'll preface my answer with a point that funding health and funding science are two different things. We need to own our health system. We can't mortgage that to anyone else. Now, it is true that when I was working for example, when I worked at the University of Maryland in the US, it is true that our research was largely funded by the US government and US corporations. But they didn't just come in and say, hey, researchers, here's the money. My supervisor then, he spent all his time writing grants to get funding. Now, it's true that he was writing those grants to entities like the NIH and the National Science Foundation, which were US entities. And what we need in Nigeria is a lot more domestic funding so that Nigerian researchers will be writing grants to Nigerian funding agencies. But it turns out that there's not a huge amount of grant writing activity happening per se in Nigerian academia and research institutions. Some of that is because, well, who do you write to if there's no research agency? Some of it is because people are overburdened with doing other things, figuring out power backup, for example, that they don't have the time. And some of it is because our research culture has not yet considered that the norm. For example, most federal universities do not in Nigeria, this is different in Ghana, they don't consider getting a research grant as something that should be featured in your promotional package. Whereas in all other countries that take science seriously, this is important, and not just for the money. It's because when you write a proposal, you compete for funding. It means that your ideas are competing with other people's ideas. And so we need that kind of healthy competition in Nigerian science because it will make the best rise to the top. That being said, for us to have it, it's not just the researchers writing proposals. We also need the ecosystem in which there would be funding agencies for them to write to that would support them. Currently, Nigeria is not doing too well on funding its science. Nigeria, like other African countries, made a commitment to spend 1% of its GDP on science, and it does not do that. We recently heard a few days ago, in response to ASU's demands, that the government is now going to start to do that. So we hope that this will materialize. But even for the countries that do that 1%, by the way, no African country is actually doing it, but for the countries that do that 1% of their GDP invested in research, some of that investment comes from the private sector. And so it's not just us watching the government to support science. Nigeria that wants to grow and develop needs to support its science and innovation so that it can actually do that.
I think it's very true that we don't fund science. And if we're saying that we may have funding come, the gap still remains that you mentioned the expertise and the time to really build in that time for institutions to see themselves as being responsible for also writing grants and developing the expertise where they actually write grants, where they're competing globally for funding. And through that, it's also, I guess, throws up the need for them to have ideas that they are able to share and find funders who are willing to fund that. But of course, the important role of the private sector, I think it's not missed. I think the same is for other areas in healthcare. We need to have more, integration of the private sector also in research. I mean, there are existing institutions, but none that we know of in Nigeria yet. Thank you for that. I'll pivot to another area of work that you have done, or you're doing a lot of research and work in, and that's antimicrobial resistance. Nigeria records about 60,000 deaths from AMR every single year. And we had the second National Action Plan for AMR rolled out in 2024, working with the Nigeria Center for Disease Control. So with our very large burden in Nigeria, with this new plan that was rolled out in 2024, what really must happen next for this plan to move beyond it just being a policy, but really drive that change at the communities and the health facilities where we see a lot of cases of AMR leading to substantial deaths?
Yeah, thanks for that question. I think on the one hand, Nigeria has done really well with AMR. This is, as you mentioned, it's not the first plan, it's the second plan. We had a first plan that went through for 5 years, and then we renewed that plan when it was up for renewal. We now have a second plan. I think we've done well in the planning side of things. I think now we have to expand the scope of what we do to implement those interventions that can actually bring antimicrobial resistance down. A lot of the antimicrobial resistance activity in Nigeria takes place centrally at the federal level, whereas the stakeholders who are going to be affected for antimicrobial resistance are very, very local. And so we need to now start to build that awareness locally, and not just build awareness, actually change behaviors locally. We need to think of stewardship antimicrobial stewardship programs that determine how we use these very fragile medicines happen not just in teaching hospitals, but in every healthcare institution, animal care institution, animal care environment. Could be somebody's backyard that uses antimicrobials. We also have to pay very close attention to infection prevention and control. If people are well, if they don't get infections, then they don't need antibiotics. They don't need other antimicrobials. So again, we have to think about very close to home. What is it that we can do in terms of infection prevention and control that makes sure that people are protected from infections? So then they don't need antibiotics. They don't need antimicrobials. Making sure that children are fully vaccinated, making sure that we have good water, good sanitation. Some of these things can not only protect us against one disease or a few diseases, they actually make us much more healthier. And then Nigeria really needs to step into discovering and developing solutions. So drug development, vaccine development, and so on. These are things that we have scientists that are involved in this in and outside the country. We need to now actually start making products, evaluating products, testing interventions so that we can build solutions to antimicrobial resistance that are well tailored to our own environment.
Thank you for that. I think what you've clearly highlighted is beyond just the second national plan for AMR, there are lots of other things and other agencies, because it's not just health, it's animal health, environment. We often focus on the health aspect, but we're also aware that AMR is a huge issue from the animal health side, given the poor regulations in animal husbandry. So our final question really to you is, looking at the impact of the work you have done so far, what really gives you hope in the future of science research in Nigeria, and what would success look like for the next generation of researchers?
I think it's that next generation that brings hope. You know, whatever I do, the next professor in my department does, is going to impact a very small number of people. But if those are people who can then do other things and impact an even larger number, then we actually move things to scale. So I think one of the things that really keeps me going, as I mentioned at the beginning, is the talent that I work with and the potential that it has to actually change things. And so we're going to have to think about how to retain that talent. We have a lot of smart people who are leaving Nigeria or intending to leave Nigeria at incredibly young ages. I mean, it used to be that people would be trained and then they can't get jobs and this makes them leave. But now when you talk to high school students, you ask them, what do you want to do? They will often say nursing. And, you know, when I was a student, someone did nursing because they admired Florence Nightingale. But now you dig deeper and they're doing nursing because nursing is really the easiest way to leave Nigeria. So I think we have to think about how to retain our talent and empower our talent to really make change.
Thank you so much for that, Iruka. We really appreciate your insights and really appreciate your time. I think what you've definitely highlighted in this interview is, you know, there is a lot of hope in Nigeria. We often look at it from the other way around of researchers leaving, but what you've clearly highlighted in your story of how you came back to Nigeria and how you're investing in the scientists that you work with, that there is a lot of work that can be done. There is a lot of potential for science discovery. Nigeria is a fertile and a prime country where there's a lot of undiscovered science innovation. And the potential and opportunities are there for scientists who you've met through your work, who really show that there is hope in the future of Nigeria. What we also need to support that is the supporting infrastructure to support your work, so that researchers and scientists are focusing on the work itself and not looking to build the infrastructure to enable them to do their work. So once again, thank you so much for your time, and it's been a pleasure talking to you.
Thanks for having me, Vivianne.
Thank you very much.
It's been nice being here.